So the event is part of the WHO-ITU joint initiative that's called Be Healthy, Be Mobile. The initiative is meant to identify technology-driven and mHealth-driven solutions to curb the burden of non-communicable diseases. And the way to do that is to bring experts in a room from all kinds of industries, public health sectors, ministries of health, which was what we've done today, to help us identify what are gaps in addressing non-communicable diseases at a national level and how we can supplement these efforts with the use of mobile technology.
I think this sort of work and the technology that comes with it could do a whole lot in the messaging, in the actual moving people down that behavioral change line. But also in what we are challenging the group in this meeting is to even go beyond that, because the evidence that we've seen that unless the infrastructure, the leadership, the supportive environment is in place, unless we work on the supply side of things as well, then trying to create a demand for something that we cannot really provide is going to be a tricky thing.
There are a lot of different types of challenges with implementing mobile technologies in healthcare. I mean, I think one of the biggest challenges is how we think about the use of technology. If we think about how the technology fits into people's lives, how it might be able to create new opportunities for us to have those conversations, to intervene, to help support what their goals are, whether they be health and wellness or whether they be better management of their conditions, then maybe we'll start to develop solutions that will really kind of answer problems for people and thereby kind of be more rapidly adopted within the system.
It is a combination of factors, and it is very much kind of bringing together technology, business, and human behavior, and understanding human behavior, understanding human beings, their aspirations, their needs, what they believe in, their fears, their hopes is really key from our point of view. And it's in many ways a way to make business and technology intelligible to, at the end, people that are going to adopt it. So when it comes to hypertension, for example, this is a behavior level problem. It's a lifestyle problem. So even if you decide to kind of use technology to try and address it, you better understand first how people behave, how people think, and how to embed these interventions into their lives to be effective.
Fortunately, in the last few years, we saw a lot of innovations coming into the market in terms of new ways of doing things, providing tools to empower the end user to take care more of their own health. And we see those types of innovation are great because the health system obviously cannot deal and cannot interact with the patients all the time, particularly for chronic disease situations. So, however, what we see in terms of the key problem is how to get those innovations to reach the right level of scale. And obviously there are a lot of barriers that we are trying to work together with the government, with all the stakeholders to kind of overcome those barriers. And one of the most important things is how those innovations be integrated within the health system and not to be always seen as a kind of an ad hoc or kind of left alone and isolated types of intervention. And this is not a very easy task, and it requires a lot of work with the stakeholders, with the government, with the health professionals to help them adopt those tools and also find the right business model to answer this very difficult question: who is going to pay for those new innovations and new technologies?
So in the health systems, mobile phones have a large role, particularly in India. And you could use mobile phones for targeted screening of patients who come to primary healthcare centers or hospitals. We can use mobile phones which are embedded with a decision support system which can guide frontline health workers in imparting lifestyle advice to patients, in actually easing the workflow in primary healthcare centers, in providing reminders and alerts to patients as well as healthcare providers in getting back patients for follow-up, in providing advice to doctors in the right kind of treatment. So there are several roles where a mobile phone can be used.
In order for health services to be sustainable and in order to reach millions more people, we have to embrace mobile solutions as part of the ecosystem of health. We understand in Bupa the burden of hypertension specifically, and what we know is we can't tackle it on our own, and we need to be working with some of the leading thinkers in order to find ways of tackling hypertension and other non-communicable diseases.
So this global mHypertension workshop has really been about bringing together a diverse group of experts to talk about what are the real challenges when we look at the use of mobile technologies for addressing hypertension and heart disease. It's one of the leading causes of death globally, and a lot of that is in low and middle income countries. So what we're really hoping to come out of this workshop is to get a really deep understanding of how we might be able to use mobile technologies to implement what we call the best buys for cardiovascular disease prevention and management. And these are interventions that have been really well studied. There's a lot of supporting evidence for them that's produced by the WHO and often local councils as well. But it's really how do we realise that opportunity for technology to create new moments, new ways of implementing these things and thinking through what kind of supporting ecosystem has to be in place in order to do this.